Welcome to the podcast, Etan.
Thank you, Matthew. Appreciate the intro.
Yeah, absolutely. Well, that's a lot of things. So congratulations on all those contributions that you've been making. Um, I I find the mega factory of healthcare to be a compelling title. So I'd love for you to just share a little bit about the focus of that work.
When we talk about healthcare, everybody encounters healthcare in their own different way and their own different mask of how they see things, right? And I think that what I wanted to put out in the world was that it's complicated. Healthcare has gotten to be a big thing. It's gotten to be complicated from a patient standpoint, from a physician standpoint, from dental standpoint, right? It's complicated on many levels, and so how do we break those pieces down to the individual parts and explain those parts to people? That's kind of what I tried to do in the book. Um, at the end of the day, I talk about how medicine or dentistry is a calling, right? And healthcare is a business.
Mm.
And healthcare has become a big business run by huge organizations. And as you're entering into that industry and you are following your calling, how do you give yourself the best opportunity to succeed?
Yeah, that's great. I think that's much needed, and I think it's not getting any simpler anytime soon, right? It's going the opposite way with larger corporate mergers and consuming smaller practices, right? So for all those people who are wanting to remain more independent and kind of write their own script, so to speak, for their career, I think it probably takes a bit more focused work and probably guidance than it ever has in the past. Would you agree?
100%. Doctors are tired. I see it much more in medicine than I do in dentistry. In medicine, doctors are tired. They're tired of having to run their practices, be a administrator, and follow all the regulations of HR and payroll, and making sure that the wheels are running on time, and dealing with the complexity of having a staff, right? You're dealing with other people. It's going to be complex because everybody has their emotional take on how to encounter the world. And so, from that standpoint, doctors are tired. They were never meant to be, wanted to be administrators. They just wanted to go to work and help their patients. On the other side of it, uh, I see that in dentistry, the independent mindset is much stronger.
Mm.
Dentists I see are much more entrepreneurial. It's probably, in the DNA of an individual who goes through dentistry and trains as a dentist. And so the help that I'm able to provide to those groups really is around how to refine the approach. What are the things that we could be looking at to help them, and give them some tools about the known unknowns, right? You know, I don't know what I don't know, so let me teach you the things that you may not know.
Mm.
And some, in most cases, it's tweaks, it's not wholesale changes.
And so,
Yeah.
in the book, then, I'm imagining you're offering some solutions, some strategies to help guide the doctors as they navigate forward.
So the book is more high level to the world in general. It's not specific to doctors. In my consulting and working with practices, I get down to what are the micro things within your area, within your specialty that work. I acknowledge the fact that healthcare, for all the consolidation that goes on, is very much local and not and can't be replicated to a cookie cutter McDonald's or Starbucks version of healthcare. You lose that personality, and in fact, you lose patience when you try to approach a market like that. And so, how do you approach the world, and how do you care for your patients in that local area in a way that's unique to them?
Okay. Okay. That makes sense. It makes sense that it would be a broader view because you're also bringing in from a patient perspective as well. So probably a lot of different people who are looking at the book, looking for something different in their understanding. Tell me just a little bit about the driving force, about kind of behind the work that you're doing. Why does this matter to you?
I have spent a lot of time working for larger organizations to ensure that we do that consolidation. And I really want to empower physicians with the tools that larger organizations have so that they can make informed decisions on how to run their businesses. I act as a fractional executive to them, a
Mhm.
strategic mind, and in a lot of cases, my engagements last 3 to 6 months,
Mhm.
just because we need to get through something, and you just can't get through it in a couple of hours,
Right.
right? I want to be in the practice. I want to understand how they operate. I want to understand what makes them unique, what their secret sauce is, because I don't want to suggest changes like a bull in a china shop. I want to really make sure that those changes are going to work for them.
Mhm.
Part of what I also do is I'm very honest about their practice with them. I find that in a lot of cases, the people that work around them are trying to placate them or trying to keep them happy about certain things, and aren't honest about, do they have a viable business? Where are the places that they need to cut? What are the expenses that are too much? And, you know, having that candor with them is really important.
Yes. Good for you, because I think that's harder to do than being kind of simply an encourager, which has its place, right? But I think we don't want it to be like the movie A Few Good Men, right? That you can't handle the truth, right? You're hoping people will be able to be receptive to hear the harder truth sometimes.
Yeah, I try to uh, frame it as empathetic candor,
Yeah.
right?
Yeah.
Because the candor is important, but you have to deliver it in a way that's going to be sensitive to, so that the person who's hearing the message will actually hear the message and not get emotional about the message.
Yeah, that's good. That's good. Well, good work on all of that. That's
Thank you.
Yeah, and I'm proud of you for that contribution that you're making. So shifting just a little bit, you have said that you believe that dentists are ahead of the game when it comes to cracking the business side of medicine or healthcare. Uh, Tell me a little bit about how you see that showing up.
Look, I've worked with great organizations like We Brighton, that is a DSO, that is buying practices. Look them up; they're a great organization. I in general love dental practices because they take a much more sophisticated approach and are ahead of the curve technologically. They're ahead of the curve um, from a documentation standpoint, from accepting new innovations. Right, there aren't many medical practices that can put in something like a 3D printer into their office,
Mm,
to be able to put in temporary crowns, um, you know, within a couple of years of the technology being commercially available.
mhm,
Right,
mhm.
dentistry did that really quickly. Part of that, I think, goes back to, dentists get a little bit of business training during their schooling. Another part of it is that there aren't large organizations where the battleship can be turned a lot easier than if they had a huge amount of partners or various locations. Um, that that agility in terms of approach is something that I commend the independent dentists and even the larger dental groups in willingness to have. Um, So in many ways, I find dentistry um, really taking a smart approach to the business of medicine.
How do you see once it does get to be larger DSO organizations? I mean, it could beyond maybe the small emerging ones into maybe a middle size or up. Where do you see the challenges, the complexities, and is that size beginning to slow down and counter some of what you're saying there in terms of in more individual practices?
It does. I think that we've seen this in healthcare where it's gotten big and innovation does slow down significantly. I think that we could see this happening in the dental space as well as it gets big. My biggest concern as DSOs start to become larger and we have a lot more employed dentists is how we ensuring that the quality that we're getting from these dentists are at the level that we want them to be, and the quality of the work, right? There's sometimes certain dentists get a bad rap because the quality wasn't great, or the types of materials they used weren't great, right? And because of that, patients have bad experiences and have to have the work redone. Um, I could concern as you become a larger organization, what corners you're cutting to keep profits rising.
Yeah, that makes sense. I think that is a viable concern and cutting corners, but also just delivering care at speed, right? There as maybe one of those corner cutting elements is how fast do we have to go and how many of those dentists, those employed dentists are prepared and capable of going at such pace and continuing to deliver quality. So I agree that's a concern.
I mean, the same thing goes with hygienists, right? Are we getting the right hygienists? Are we having them, do they have enough face time with the doctor to be able to understand the things that they should be looking out for as they're doing cleanings? Is that model working well in each individual office? Um, and are they looking out for the right things to be able to do the right preventative medicine? I will tell you from personal experience, having an amazing dentist, preventative dental care is vital to your overall health, as you know, as a dentist.
Mm.
And we want to ensure that we keep on having access, people having access to that good dental care.
Yeah, that's good. I was thinking one other question there, but I'm going to let that go and we'll move on to kind of the next question I have for you, which is can you share a little bit with us your philosophy on the integration of holistic practices within conventional dentistry? And how do you believe this approach can transform patient care and outcomes in the dental field?
Yeah, so I've seen a number of practices. One of them I recently worked with called Park Smiles in Manhattan. They have periodontists, they have oral surgeons, they have pediatric dentists, they have adult dentists, they've got a range of hygienists. They've got basically anything that you need um, for for um, your life cycle to happen at that office. And why is that important? Because just as in medicine, having a holistic approach and a team approach to care, having a team approach to your dental care is also vitally important. If you're handing off within the office, then you're not having to repeat um, radiology. You're not having to repeat having to have consult visits. You have the person in the office who can take a look and see, oh yeah, we need that. We can get you in for that next week, right? We're not delaying care. So these ideas of holistic offices and holistic dentistry, where you're getting a lot of those services in one place, I think is critical to moving care forward and maybe even uh, helping the cost curve a little bit. Where it works very well in places like Park Smiles.
So part of that, if I'm understanding correctly, is, through a life cycle in terms of something more age specific or kind of demographic specific, or various types of expertise being reflected in a practice. But are you also saying that the an integration of people with a more proactive, preventative, or maybe larger wellness scope type dentists, which is a subset of the overall dental population? Some are not oriented or interested necessarily in that direction. Some are adamantly for that. And so do you see an integration within practices of some people who are maybe just more acute care, delivery of kind of pressing needs of the moment versus people that are also in that same practice group that are being more preventative?
Yeah, I think it's like many medical practices where you have certain doctors who are focused more on preventative medicine and more on acute and chronic care management. The same can happen in a dental practice. It's just about how you approach the clinical protocols and the approach to the dentistry or the medicine.
Yeah, I think that's interesting. I would love to see more integration, I guess, along those lines. There's a part of me that always wants to see more doctors who are seeing larger kind of oral systemic health connections or larger, a bigger proactive or preventative take or contribution to dentistry. But I think it would be great to have more blending for those people, kind of a bridge across rather than being kind of sometimes feeling to me like separated polarities a bit. And that I think is in medicine as well, that it's sometimes there's this separated polarity of perspectives, and somebody's more right and somebody's more wrong, rather than this is kind of how I prefer to see it, and this is my preferred contribution. Do you think that does that seem right to you, or how would you speak to that?
Look, I think that we have to follow the patient, right? What does the patient want, and what is the approach that the patient wants to how do they want to approach their care? And I think that there's a reason why Baskin and Robbins is still in business, and there's 31 flavors, right?
Right.
Um, I hope I didn't just age myself, but I think that that same thing goes. Some things work for some people, and some other things work for others, and it's the groups that are open to having differing opinions in an office that's all about helping out the patients, serves the physician better and serves the patient better.
Yeah.
And that team approach can very work very well in both medicine and dentistry.
Yeah. Good point. Good point. A patient focused direction on where things are going. And I'm glad you brought up Baskin Robbins, because that was one of my first jobs when I turned 16. So that was a couple of years ago. So thanks for
You're welcome.
reminding me of that part of my past. So uh, talk a little bit about technology and patient experience and kind of how you see them being factors in kind of in this evolving dental world.
So, look, the patient experience is something that has become at the forefront of healthcare for the probably the past decade, right? Where organizations are spending a lot more money and time to ensure that the experience of the patient in the care setting is is invaluable to them. You see that in big urban areas where there's a lot of options,
Mhm.
and you can pick where you want to go to have a baby, or you can pick where you have to go. When you're generally, and I'm speaking very generally within dentistry, there are a lot of dentists, and the way that you can differentiate yourselves are the way are how do you approach the experience of your patient? Are you sending them digital reminders? Are you giving them the ability to schedule online? Can they pay via text message? Um, do you have some nice, you know, something on the ceiling that they're looking at to make them forget about the fact that you're torturing them for 45 minutes? And I say that in jest because they're caring for them. They're not really torturing them. But a lot of people think that that's what happens when you go to a
Right.
dental office. Uh, what's the secret sauce in terms of making each and every patient comfortable when they come into that office? And it could be a little thing like numbing them before they have a cleaning, or putting a topical on before you give them a shot, right? It's that care of, even to the point of, um, apologize, I'm sorry I'm doing this, but we got to get you healthy.
Mhm.
That's really important from a technological standpoint. The innovations that have become available over the past 4 or 5 years are unbelievable, and the adoption on the part of dentists has been fantastic because they are agile and they're willing to try stuff out. You know, you look at the amount of time that dentists have been on electronic records. They got it. They don't necessarily complain about it.
Mhm.
It makes their lives so much easier, right? They are on digital X-ray, and they're on, and they they want to be at the forefront because it makes their lives easier, and they see that.
Mhm.
um, I think that there are some more innovations that are out there that are going to be helpful for them, and we'll see. Time will tell how adoption goes, like how AI will be part of um, uh, determining long-term health of a tooth, or to help um, doctors chart faster and more efficiently,
Mhm.
um, and how that will help in the billing process, right? I think that we'll get smarter on the delivery, which will help the experience.
That's good. One more question related to that before we wrap up. Uh, where might you see any collision between the technology, including communication technology, colliding with patient experience, or maybe even true communication? Do you see any
I think
conflict?
the collision happens when there's a lack of training specifically on how to communicate from an empathetic and respectful nature on the part of the staff, to put the patient as a customer first. Um, there's no forgiving a patient who is inappropriate or doesn't talk appropriately. No forgiving that. I've done it. I've had bad days and spoken to staff members at offices, and it was terrible. I was wrong, right? You have a bad day and you apologize, but I think that the approach, and how we communicate and how we get things done, is the most important thing to teach the staff. That text messaging is great, but a lot of the time you're going to have to pick up a phone. And how do you pick up the phone? Do you pick up the phone with a smile on your face, or do you pick up the phone doctor's office? You
Right.
know,
Yeah.
and so approaching the world with a smile on your face and really being positive is is going to win you more um, patience and a better reputation. Um, I think that collision really comes into play when you're talking about reviews, right?
Mhm.
Reviews, online reviews, and online communities can sink a practice very quickly. And taking hold of that, accepting that it's a thing, and not ignoring it, is really important. How are you going online to look at your reviews? Are you going online to actually answer complaints that are out there and saying, please call the office. We'd love to speak to you about that, right? That's okay.
Yeah.
It's okay to break the fourth wall and say, we acknowledge you. We acknowledge that you had a bad experience. How can we fix it?
Mm.
Because if not, it's just going to sit out there and fester, and how many patients are you going to lose from that?
Yeah. Yeah, that's true. What could have been in the past a kind of a quiet individual experience that wasn't pleasant now in today's world becomes fairly quickly a collection of more public uh, frustrations. So I think you're right. I think that's a good point.
Yeah.
So in wrapping up, for everybody who's watching us, listening to us, that says, I like what you're saying, I'd like to know more. What's the best way for people to get in touch with you? What might that look like?
Send me an email, Etan Walls, ETANWALLS at gmail.com. My website is strongwallsconsulting.com. But send me an email. I always talk to owners um, uh, for free for the first couple times. First couple times is really true, um, and and um, I'm there to help. Um, I'm not so expensive, so don't get thrown off. And really, I'm here for when life happens. Every day something can challenge you in your practice, and I'm here to be a partner. And I do have a lot of resources behind me. That through my contacts over the years, I have people who have helped practices in many different ways. And if I can't help, I'll definitely put you in contact who can.
Great. Well, I thank you so much for your time and the insights you shared. I think you have some kind of a combination of interesting perspectives that are valuable. And so I hope that some of our viewers will follow up with you and take advantage of that opportunity. So thank you very much for your time today.
Thank you so much, Matthew.
All right. Well, thank you everybody for watching. Matthew Norton, and this is the Truth Behind Dentistry podcast. And we have been here with Etan Walls and look forward to seeing you next time. Thank you.